So this is your second X-ray. Can you see this area where there's a clear demarcation between the lung border and the hypolucency? So this is your collapsed lung and this is the hypolucent area or the area filled with air. And you can also see there is a mediastinal shift and the trachea is also slightly deviated to the left. So I hope you have already made a diagnosis. This is an X-ray of tension pneumothorax. So there you go, your first kind of MCQ. Identify the X-ray. So here you saw hypolucent area with mediastinal shift and tracheal deviation. So this is an X-ray of tension pneumothorax, and I also want you to look at both the sulcus or the costophrenic angle on the right side is very deep compared to the left side, and here there are no lung markings, whereas here there is clear lung markings. So these are the points I want you to make a note of when you see an X-ray of a pneumothorax. There can also be an X-ray of a simple pneumothorax if there is no mediastinal shift and no tracheal deviation. So make sure to look at the vitals in the question asked. If there is no mediastinal shift and if the patient is vitally stable in your given MCQ, then the answer would be simple pneumothorax. And in this case, there is mediastinal shift, there's tracheal deviation, and in the question also you can expect the patient to be hemodynamically unstable. The second kind of question, that is, we discussed the first kind of question, that is identify, and we also discussed the second kind of question, that is the key clinical feature of tension pneumothorax. That was your mediastinal shift, tracheal deviation to opposite side. I want you to make a note of this. Now, he can also ask you a question, which of the following statement is false? And in that, he can mention mediastinal shift to the same side. Be very careful. It's mediastinal shift to the opposite side and not the same side. And also the patient will be unstable. And the third type of question, that is, what is the next step you do in tension pneumothorax? You do immediate needle decompression. Needle decompression in fifth intercostal space. Make a note of this recent update. I don't want you to mark second intercostal space. You can have both the options. You can have second intercostal space and fifth intercostal space. So fifth intercostal space in the mid axillary line is the best option. And you can also have a fourth type of question in this, that is the definitive management. So in tension pneumothorax, needle decompression would be the immediate next best step, and the definitive management would be ICD insertion in fifth intercostal space, again in the triangle of safety. I hope you have understood the concept of tension pneumothorax, and I hope you have also understood the four kind of MCQs which can be asked.